In response to widespread school staff shortages coupled with high demand for COVID testing, Governor Charlie Baker activated 200 members of the Massachusetts National Guard today to help fill that gap. He also activated another 250 Guard members to step in if state prison staff walk off the job over vaccine mandates, as they've threatened to do ahead of the deadline this coming Sunday. Of course, those state mandates come a few weeks before military mandates go into effect. And the number of troops who've yet to comply across the country are still in the hundreds of thousands, according to Pentagon data published by the Washington Post. But when it comes to anti-vax threats against mandates, we really haven't seen too much follow-through so far, despite the Mass State Police Union claiming dozens of troopers were planning to quit. State police officials say they're only aware of one such trooper. And as the Boston Globe reports, hospitals across the state are planning to fire hundreds of employees who defy mandates in their industry too, although they're hoping to convince as many workers to get the shot as possible before the November 1st deadline. And as for those still on the fence without mandates that may sway them, the U.S. Department of Health and Human Services has decided to stop playing so nice with its ad campaign.
Been in the hospital for 76 days. I died 3 times. They gave me a 5% chance of living.
People are younger and sicker, and we're intubating and losing people that are my age and younger.
I went from being a man who loved to play outside with his children and exercise to a man who barely has enough energy to make it through the day. Whatever the side effects of the vaccine may be, I can promise you they're not worse than this.
It's a markedly different tone than the upbeat encouragement they were putting out before. But will any of this be enough to get the nearly quarter of people who are eligible for shots but haven't gotten a single dose to comply? I'm joined by Dr. Benjamin Linas. He's professor of medicine and epidemiology at Boston University Schools of Medicine and Public Health, and State Representative Jon Santiago is also an emergency room physician at Boston Medical Center, a captain in the Army Reserves, and a former candidate for mayor of Boston. Doctors, it's good to see you both. Thanks for being here.
Good to be here. Thank you.
Dr. Santiago, can we start with you and do your military connection first? You know, as an outsider, discipline, following orders is what I thought happens in the military. And while we read that 90% of service members in the Navy are vaccinated, as I said, hundreds of thousands of other military members are not. Why?
Well, my guess, Jim, is that you'll see in the coming weeks, you'll see an increase in the number of military folks vaccinated. I mean, you said 90% of active Navy, they're vaccinated. I think the number is 81% for the Army. We still have a couple of weeks, in some cases months, until the vaccine mandate goes. But you're absolutely right. Soldiers follow orders. Listen, before I was deployed, I got a whole host of vaccinations. My guess is that you will see a number of people get vaccinated. In fact, Jim, after the military introduced their mandate in the Marines, you saw about a 300% increase in the following 6 weeks. So my hope is, and I remain optimistic, that more military members will get vaccinated as the deadline approaches.
But the Marine numbers are still low. I think even with that increase, I think my reading is it's roughly in the 70% range. What should happen to these people if the deadline is reached and they haven't complied, Dr. Santiago?
Well, my guess is that the Department of Defense has a whole host of progressive infractions that they could use. But for right now, I think the pressure, soldiers, we have the best soldiers across the world. They do follow orders, they do follow command. My guess is that most will get vaccinated.
Dr. Linas, let's move to the healthcare world, hospitals. You know, I read last week on one end of the spectrum, there's Kaiser Permanente, where I think somewhere in the neighborhood of a 20% increase since the mandate went into effect from the mid-70s to the low 90s. The flip side is I'm watching CNN last night, and there's a CEO of a hospital in rural Missouri where a significant chunk of nurses aren't vaccinated. And in fact, he said the mandate hurts the effort to get people vaccinated, drives them in the other direction. Are mandates the right course in the healthcare world? I can't see any other route. Is there one?
Right. I think that's sort of the question of the hour. I agree with you. I think that it's absolutely essential that we're vaccinating everyone in our society and absolutely our healthcare workers. And if people are wishing to be employed in a healthcare setting, then there is an obligation to be vaccinated at this point. So I think that vaccine mandates are absolutely ethical and appropriate in a healthcare setting. As a policy question, is it the right way to go? I think that's a much trickier question Because as you pointed out, even with high percentages of vaccination, it's a large healthcare workforce. And so small percentages of unvaccinated people can result actually in tens of thousands of layoffs.
But if I may, Doctor, I don't understand what the ethical issue is. If you're going to treat a patient, how can you possibly, or be in the proximity of a patient, how can you possibly be unvaccinated?
I completely agree with you. I wasn't clear enough. I do not think there's an ethical issue with a mandate in healthcare. No, it's fine. I'm sorry to misspeak. So I agree with you. There's no ethical issue. It's if you wish to work in a healthcare setting, you must be vaccinated. Right? That's you don't have a right to work in a healthcare setting. And if you want to be in a healthcare setting, then you need to be taking care of the people around you. That's why we're there. But as a practical matter, I think it can be challenging because if you're looking at tens of thousands of potential layoffs, it's not clear how we're going to rehire those people. And if we do rehire people, will they be vaccinated? So as a policy question, I think it's really challenging right now. I agree with your sort of initial take of, I don't see any other way forward. I think we do need to have these mandates, but we need to be ready for the fact that it's not straightforward what to do when people aren't vaccinated because you can't necessarily replace the workforce that you're laying off.
Dr. Santiago, I know you both have a Boston Medical Center connection. How are we doing on vaccinations at the BMC?
I think on the whole, I think they're doing go ahead.
No, please.
I was just saying on the whole, they're doing an incredible job. I just got my booster this past weekend at the hospital. I worked an overnight shift. I literally finished my shift at 7 a.m., got my booster. My arm's just a bit sore right now. But I think on the whole, I have to credit the operation for conducting a process that was fluid, and they got a number of people vaccinated during the surges, but also in the midst of a booster.
Let me just say, Dr. Santiago, as a non-medical person, I would say sore is better than dead is my motto. So I think you should grin and bear it, as I'm sure you will. I want to get back to something you said, Dr. Linas, about the consequences of this. I understand. We spoke on the radio the other day to the head of the UMass Medical Center, and obviously they're talking about ICU bed shortage. They're having issues too. But the reality is as painful as the consequence is, meaning staff shortages, as we were saying a minute ago, that can be fixed by the employee by getting vaccinated. If they choose not to, there is no alternative except to figure out how to deal with a shortage. Isn't that the case?
Well, sure. I mean, I suppose there's another potential there that we could say we're not going to mandate vaccine and continue to work with folks who are hesitant and keep them in the workforce and try to get them vaccinated. But I understand your concern, and I just think that New York went through this about a month ago. Yeah. They were looking at tens of thousands of people that were going to be laid off, and it wasn't trivial to say they were going to replace that workforce. So at a time when we could be looking at surge situations, going into the winter, there could be more COVID. There could be more COVID burden on hospitals, and if at that same time we're laying off a big fraction of our workforce, we're going to create a problem for ourselves. Unfortunately, it's easy to point to the problems. It's a lot harder to point to the solutions right now.
But let's talk
Jim, let me just add.
Yes, Doctor.
Let me just add, we're talking about laying off people who do not want to get vaccinated. And if you're on the floor of the emergency department or in the halls of the hallway, people are just tired. People are burned out. People are overburdened with the amount of hospital boarding that is taking place, psychiatric patients that need services. That is what's driving people to leave the profession. Right now, from my experiences on the front lines. People talk about a vaccination, but I'm telling you, people are leaving because they're just burned out.
But Dr. Santiago, let me start with you for a minute. As Dr. Linas said, the solutions are much tougher than the, figuring out what the problem is. Dr. Fauci has said mandates work, and I think the overwhelming evidence is they do. But for those who don't, we played a couple of minutes ago scenes of people in immense kinds of suffering. If seeing that kind of suffering, whether you're a healthcare worker or not, doesn't do the trick, if the threat of losing your job doesn't do the trick, what does do the trick? What will convince the hesitant, and I'm being kind, to become unhesitant? Dr. Santiago first.
Well, you have to really set expectations. We're not going to be able to vaccinate 100% of the people. This herd immunity that we've talked about over the past 18 months, it's an elusive number.
Yeah.
I think Dr. Fauci used the word elusive, and I think, if he can get to 70, 80+%, I think we'd be in a good space. But right now, I think mandates, not just in the healthcare infrastructure, but across the public and private sector, it's what's needed right now. You have people talking about or saying, I will not work if I'm mandated to get a vaccine. And that's frankly, from what I'm seeing and what I'm reading, not the case at all. We know that the state has moved forward with a whole host of mandates. My hope is that the private sector does follow in short course. But I think with mandates and making sure that those communities hardest hit by the virus, that are less likely to get vaccinated. I mean, here in Massachusetts, we've done one hell of a job with respect to vaccination. Still more work to do, but in communities of color, community hardest hit, we still have a tremendous amount of work. And I think it's going to be a block by block operation that is culturally competent, linguistically appropriate to get those folks vaccinated.
I only have 45 seconds, Dr. Linas, but you're the one who said the solutions are hard. But despite that, what is the solution as best you can figure out?
Sure. I mean, I think the vaccine mandates are working, that we need to have them in place. But then we're going to be left with this setting where they're never going to be 100%. And we're going to need to work with those who aren't vaccinated. And it is slow going now. We've been working hard about that at BMC. Fear is generally not the right approach. I will say that. Folks that aren't vaccinated now know that the reason they're not getting the vaccine has nothing to do with whether or not it's going to prevent disease. There's a lot of reasons that people have for their resistance or their hesitancy. And I think it's about understanding that and addressing them where they are. But that's a slow and difficult process.
Well, you're both kinder than I am, but I'm glad you're both dealing with the issue. Dr. Linas, Dr. Santiago, thank you so much for your time. I appreciate it.
Great to be here. Thanks.
Thanks.